Acne scarring is obviously very common, and we see it in up to 85% of patients with acne. So actually thinking about how we can actually mitigate acne scars is really important. And we know there's a correlation between acne and duration. So one thing is really important to start early effective therapy. We know inflammation is absolutely key to acne development and scarring. So actually thinking about treatments that will target that inflammation early is really important. And then to think what treatments are available. So there's been quite a lot of interest in this for some time, and the newest product that's on the market is a combination of adapalene 0.3% with benzoyl peroxide 2.5%. And there's been a very nice study showing that's highly effective in acne, so it treats it effectively early. And when they looked at a prolonged course of treatment, which was extended from 24 weeks to 48 weeks, a split-phase study, they found that the number of scars that were found in the active treated arm was less than in the placebo treated arm or vehicle treated arm. And when they continued over the 48 weeks, they found again that the number of scars was less. So this is really interesting, and the thought behind it is it's the collagen change that's caused by the retinoid, topical retinoid. And so for once we've got a medical treatment that potentially will actually both treat acne very effectively and reduce the likelihood of scarring and potentially improve the scars that have actually formed. So number one, I think about risk factors. So actually identify if there's a family history of scarring. Number two, look at the severity of acne, because we know that more inflammatory, severe acne is more likely to scar. And also look at whether the patient started to scar. And you see early scarring, I think it's important to think very carefully about informing your treatment to try and mitigate their scars developing further. So those are my three major tips in terms of treating acne in a way that would avoid scarring. So I think in treating scarring, we'll look further at areas where we can actually treat the scars, because obviously if we're getting new novel treatments that treat acne early, then we can prevent them. But I think treating the scars is very interesting. There's been some interesting presentations at the conference about using combined methodology with energy devices and treatments that are actually delivered by energy devices into the skin. So I think there are going to be quite a lot of potential pharmacological developments in the way we actually deliver things into the skin and can actually improve scarring. We completed a study which was looking at microRNAs in patients that scar and don't scar, and saw some very different differences. So there may be actually things where we can actually look at biomarkers and try and identify who might scar, and actually potentially look at microRNA targets for scarring. So it's quite a lot of new things on the horizon that I think will help patients with acne scarring. I think the one thing really is just that acne scarring is an indelible sign on patients, and I think it can have a significant psychosocial impact. It is really important that we actually look for it as a sequelae when we're managing our acne patients, think about avoiding it and where possible treating it.